It's a very cold Saturday morning, so I hope you're all warm at home and you have a nice cup of chai or warm milk with you. And we'll spend the next hour learning a little more about maintaining healthy mineral levels. Through the attendee chat, if you can just let me know if you can hear me clearly, please. Okay, I'm assuming everyone can hear me. Please let me know if you can't, and we'll get started. So my name is Fatim Ajwani. I'm a registered dietitian in Toronto, and I have the honor of talking to you this morning. The reason I've chosen this topic is oftentimes with the new year, many people make resolutions. These resolutions often have to do with diet, and I hear lots of people saying, oh, I'm going to eat healthier, I want to manage my weight, I'm going to watch my fat intake or my protein intake. But oftentimes, while we're following all these great diets, we forget about the core reason why we are eating, and that is to nourish our body. And oftentimes in the big picture, we forget the little picture in terms of maintaining our nutrient requirements. So this morning, I'm going to focus on adequate minerals. My focus is going to be on adults and specifically women's needs. I will be covering calcium, magnesium, iron, and zinc. I'm not going to be talking about potassium this morning. I did cover that quite a lot in my last presentation, and that's archived in the Ali webinars, and you can have a look at that. So our goals this morning are to understand the role minerals play in the body and their importance to our health. We'll talk about the requirements and sources of calcium, magnesium, iron, and zinc. We'll talk about tips to achieve adequate mineral intake from our diet, and then we'll learn the pros and cons of taking mineral supplements. So if we start off and we just talk about what are minerals, this is actually just the definition from Wikipedia. Minerals are basically chemicals that organisms need to survive and to perform the functions necessary for life. Minerals come from the earth and they cannot be made by your body. Plants get their minerals from the soil, and animals get minerals from eating those plants and eating other animals. The first mineral we're going to talk about is calcium. Now, I'm sure many of you know the importance of calcium in terms of maintaining your bone health, but calcium also has many other roles in our body. It's important for muscle function, for nerve signaling, managing our blood pressure, and we know that getting adequate calcium can help protect against osteopenia and osteoporosis, also certain types of cancers like colon and rectum cancer, and also help manage things like hypertension and prevent preeclampsia. When we look at calcium, we know that in Canada, 87% of women between the ages of 19 and 50 don't get enough calcium. And you'll notice from the chart, the daily goal for calcium intake is between 1,000 and 1,200 milligrams for adults. You'll also notice I have a column called Stay Below. That represents the upper limit or the tolerable upper intake for calcium. And all nutrients have this upper limit. This limit is set based on adverse reactions and long-term risks of taking more than that amount. And every nutrient has an upper limit. So for calcium, that upper limit, you'll notice it's between 2,000 and 2,500 milligrams. And that limit is on both your diet and your supplements. Now, oftentimes in practice, I'll have patients come to me taking very high dose calcium supplements that they say were recommended by their doctor, but oftentimes they don't mention to the doctor the amount of calcium they're getting from their diet. And this can lead to problems if you're going above that 2,000 milligrams. Now, if we look at calcium deficiency, There are no short-term obvious symptoms. It's not something that can be measured from a blood test because our body is very good at regulating the amount of calcium in our blood. However, calcium levels can drop with other medical conditions such as renal failure or when you're taking other medications. This can lead to what we call hypocalcemia, and some of the symptoms include numbness and tingling in your fingers and toes, muscle cramping, poor appetite, and abnormal heart rhythm. It can lead to death if untreated. However, this is a very rare condition. Most of us, however, do end up with long-term inadequate calcium intakes, and this can lead to osteopenia, which is a weakening of the bones, followed by osteoporosis. This can lead to an increased risk in bone fractures, especially in the elderly. Now we know in terms of calcium deficiency, those that are at most risk are postmenopausal women because after menopause, with the loss of estrogen, you do have a decrease in calcium absorption and an increase in calcium loss. Usually, for the first few years of menopause, there's typically a 3 to 5% bone loss, and then after the age of 65, it drops to about 1% per year. We also know that those with milk allergies and vegans also tend to have a higher risk of calcium deficiency. So if you do have lactose intolerance or a dairy allergy, you are looking at alternate forms of calcium other than milk, but it is quite possible still to get enough calcium in your diet. Now, if we look a little more at osteoporosis, our bodies are making bones. I guess the peak would be in our teenage years and our early 20s. Bones increase in size and weight until about the age of 30. So the greater your peak bone mass, the longer you can delay osteoporosis. So it's very, very important that you consume adequate calcium, especially in childhood, adolescence, and early adulthood. Now, osteoporosis occurs when the body either loses too much bone or makes too little bone, or a combination of the both. So bones become weaker, they're more likely to break. This can be tested through a bone mineral density test, and this is usually what they use to diagnose osteoporosis, and it compares your bone density to the optimal level of a 30-year-old. Women are at higher risk because they start off with smaller bone mass and smaller skeletons than men, and they also have faster bone loss after menopause. We know also that if you are inactive or you smoke or if you have a family history of osteoporosis, your risk also increases. Keeping up with adequate calcium intake and also adequate vitamin D intake combined with exercise, so both weight bearing and resistance training, can help maintain your bone health. I'm just sharing some facts from Osteoporosis Canada. We know in Canada, and this is probably very similar in the US and also in Europe, but in Canada, 2 million Canadians have osteoporosis. 1 in 3 women will suffer from a fracture due to osteoporosis in their lifetime. And over 80% of fractures in those over the age of 50 are due to osteoporosis. And this is the scary one. 28% of women who suffer from a hip fracture will die within 1 year. And it's not because they've broken a bone, but it's because of all the complications they can suffer in hospital, and also due to that lack of mobility. So let's look at how we can maintain our bone health and the calcium in our diet. So the best sources of calcium would be things like milk and milk products. So when we look at milk or yogurt or cheese, those are all very high in calcium. We can also look at alternatives such as fortified soy beverage and almond milk. Those can also be a good source of calcium. We know that milk is naturally high in calcium, but with your milk alternatives, they've added calcium. And you really want to pay attention, and I will talk about the labels in a minute, but non-dairy milk, such as soy milk, does have calcium added to it in Canada. Other milks like almond milk, hemp milk, coconut milk may not have as much calcium, so you really want to check the label. Aside from these milk products, things like canned fish, so if you think of canned salmon or canned sardines, would also be an excellent source of calcium. I just have a list of a few examples of foods rich in calcium. So you'll notice milk at the top giving you about 300 milligrams per cup. Now, I often ask my patients, how many of you drink at least 3 glasses of milk a day? And I find not many do. And you can ask yourself that question as well. That's basically what it would take to meet your calcium requirements. So if you're not a milk drinker, then you want to think about other forms of calcium. So are you eating yogurt? Are you including things like cheese or tofu? Do you eat that canned fish? And also, if you look down the list, I have some vegetable sources as well as nuts listed there. Oftentimes I have people tell me, well, I don't drink milk, but I eat a lot of spinach or I eat a lot of broccoli. But you'll notice that the amount of calcium in those vegetables is a lot lower than the dairy products. And you have to eat an awful lot of kale or broccoli or spinach to meet those calcium requirements. Also with the nuts, although things like almonds do have calcium, the amount is much smaller than what you would find in dairy products. So things to remember when you're looking at your diet and making sure you're getting enough calcium. Things like drinking milk with our meals or at bedtime. It's not just for kids. I think as adults as well, it's a great way to get calcium in. If you don't like plain milk, you can try things like buttermilk or chas. Add more milk to your chai or coffee. Have a latte. Do half and half milk and water when you're making your tea. You can replace water with milk in recipes. So for example, if you're making oatmeal or porridge or you're baking things like muffins, you can easily add milk to those recipes. Another way to increase your calcium is to have more yogurt or raita with your meals. Use yogurt and fruit as a snack or as a dessert. And also including lower fat cheese like cottage cheese, ricotta cheese, and skim milk mozzarella is a great way to add not just flavor, but also calcium in your foods. And the reason I have specified lower fat cheese is because cheese can be extremely high in saturated fat, and we don't want to increase our cardiovascular disease risk by eating too much high fat cheese. Now, in terms of enhancing the absorption of the calcium we eat, calcium absorption does vary depending on age. Children absorb as much as 60% of the calcium in their foods, whereas adults it can drop to as low as 15%. One good way to make sure we're maximizing our calcium absorption is to make sure we're having enough vitamin D. Now, vitamin D, it's usually called the sunshine vitamin. That's the best source of vitamin D. So if you're getting enough sunlight, your body is getting enough vitamin D. However, in northern climates such as Canada, we don't get enough sun. And also when we're wearing hijab and we're all covered, our sun exposure is reduced. So it is a good idea and actually a recommendation that all adults living in Canada or northern climates do take a vitamin D supplement. It's actually the only supplement that you need in your diet, and the recommended amount is between 800 and 1,000 international units of vitamin D per day. And that's typically what you might find in an over-the-counter vitamin D supplement. Now, we also know there are certain things that can hinder calcium absorption. There are oxalic acids and phytic acids found in foods such as spinach, beans, and whole grains that can limit calcium absorption to a small extent. However, in people that are eating a balanced diet with lots of varieties, these phytic and oxalic acids are quite insignificant. We know certain other foods can also reduce calcium intake. One of those are foods that are high in sodium. So we know that a high sodium diet actually decreases calcium absorption. But when it comes to other foods like caffeine, protein, phosphates that you might find in cola beverages, although they might decrease calcium absorption slightly, the effect is pretty insignificant overall in your diet. Now, when you are looking at calcium on labels, and here I have the nutrition facts panel, and this is off of just a bag of Nielsen milk, what you want to look for is at least 30% calcium per serving. And you'll notice here too, there is vitamin D, because in Canada, they do add vitamin D to fluid milk. It's not added to yogurts or cheeses, but it is added to milk. So it's something to pay attention to, that calcium percentage as well as that vitamin D percentage. Now, this is a neat tool. This actually was just released this week, so very timely. And it's an app called the Calcium Calculator. And this can help you calculate the calcium you're eating on a typical day. It also gives you a list of foods and their calcium content, and helps you to incorporate more foods that contain calcium, and gives you tips on increasing your calcium intake. So it's a free app. You can download it to your phone. Just a neat tool to have. Now, what about supplements? So I'm going to talk about supplements generally first and then specific to calcium. So as a dietitian, I always recommend that people try to get their nutrients from their food first and supplements as sort of a last resort. The individual nutrients that you find in foods are never the same as what you can get in a supplement. Foods also contain other healthy compounds like phytochemicals and antioxidants that you can't replicate in a pill. And these work beyond the vitamin and mineral content. We know high-dose supplements can sometimes do more harm than good. They can react with medications. So it's really important that if you are considering taking any type of supplement, whether it's calcium or another vitamin or mineral, that you always speak to your doctor, your pharmacist, before you start taking these supplements. Now, when we look at calcium supplement, there are basically two main forms that you can buy. There's calcium carbonate that is inexpensive, but should be taken with food. This is the type you might find in also over-the-counter antacid like Tums or Rolaids. Those are also calcium-based. The other form of calcium is calcium citrate. This can be taken with or without food, and oftentimes it has fewer side effects. So when taking calcium supplements, side effects include things like gas or bloating or constipation, stomach aches. That is something to consider. The other thing that's important to note, that calcium has the highest absorption when you keep your dose less than 500 milligrams. So oftentimes I have patients who are taking 600 or 750 or even more than 1,000 milligrams in one pill, and it's always a better idea to have a smaller amount split over the course of the day. It is important to remember that calcium can interact with certain medications. And then lastly, there is some research that shows that when you take very high calcium supplements, it can lead to calcification in your arteries, and this can also lead to an increased risk of heart attacks. So especially if you are dealing with any type of heart disease or stroke or cardiovascular issues, you want to really be careful with calcium supplements. And I guess the bottom line is always try to get your calcium from your foods and limit the amount of calcium supplements you take. If you have any questions, I'm happy to answer them as we go along. You can type your question in. I'll also leave some time at the end. So at this point, any questions about calcium? No, you can feel free to type it in. I can answer it as we go. So the last thing I wanted to mention about calcium, and this is a question I often get or I often see, and I'll have someone come to me and say, well, I can't drink milk or I can't eat yogurt because I have a family history of kidney stones, or I'm very prone to kidney stones. So if we look at the research, we know that dietary calcium does not cause kidney stones. It's actually high oxalate foods and low fluid intake that actually have a bigger role in terms of kidney stones in the diet. We do know that calcium supplements can cause kidney stones if taken in high amounts. However, these studies are part of that upper limit or the stay below number when it comes to calcium intake. So if you do suffer from kidney stones, don't stop drinking the milk, just be careful with the supplements. So I have a few questions that have popped up. So can the body store any extra calcium? Absolutely. Your body will store calcium in your bones. So the higher your calcium intake, the more that is stored in your bones. And then if a question about being allergic to milk and milk products, you can look for alternatives. So I mentioned things like fortified soy beverage or fortified almond milk as a good way to get calcium in. You might look at alternatives. And in terms of supplements, especially for children, I would really consult with your doctor first before you go to supplements. But there are plenty of alternate ways to get calcium in your diet. And you might look at that calcium calculator app, because that also gives you alternatives to milk and dairy. Okay, so I have a question here about what's good for constipation, and maybe my next mineral might be something that helps. So I want to talk a little bit about magnesium, because I think that's often an ignored mineral. When we look at magnesium, it's so important in our body. And we know that magnesium is part of more than 300 enzyme systems. And magnesium is important for energy production, for protein synthesis, muscle and nerve function. It's involved in blood sugar regulation. It helps regulate your blood pressure. And we know that adequate intakes of magnesium can protect against heart disease and stroke, type 2 diabetes, osteoporosis, migraines, and also sleep disorders. So you can see how important magnesium is in our body. And again, like calcium, most women, adult women in North America, are not meeting their magnesium requirements. You'll see from our chart here that we require anywhere from 310 to 400 milligrams of magnesium daily. Now, here on the stay below column, you'll notice it's 350 milligrams across the board, and sometimes that's actually less than the daily goal. And just let me explain that. So we know from magnesium, there is no upper limit through diet. The upper limit is only through supplements. So that 350 milligrams represents the maximum you should be taking from magnesium supplements. Now, in terms of magnesium deficiency, again, it's difficult to assess from blood work. Our magnesium is mostly stored inside our cells and in our bones. Our kidneys are also very good at limiting the amount of magnesium we get rid of when our levels are low. However, again, with certain conditions like gastrointestinal disorders like Crohn's or celiac, you do see a greater magnesium loss and a drop in levels. We know for those living with type 2 diabetes or insulin resistance, there's more excretion of magnesium. We know in older adults, there's a lower magnesium absorption. So early signs of deficiency would include things like nausea, fatigue, weakness. This can progress to cramps or seizures and abnormal heart rhythms. Also, because magnesium is such a big part of all the enzyme reactions and mineral reactions in our body, magnesium deficiency can also lead to calcium and potassium decrease and loss of balance. Now, if we look at foods that are the best sources of magnesium, you'll notice here are legumes, so things like beans, lentils, and chickpeas. Nuts and seeds, also a great source of magnesium. And then things like whole grain. So when you think of brown rice or whole grain, whole wheat or barley, those are also great magnesium sources. An easy way to remember if something is high in magnesium is to look at the fiber content. So if it's high in fiber, it's often also high in magnesium. And just some examples of magnesium in foods. So you'll see at the top of the list things like your seeds and nuts. Peanut butter would also be a good source. Things like black-eyed peas, kidney beans, lentils, also a great source. Fortified cereals would also be a good source of magnesium. And then to a lower extent, things again like your green vegetables would also contain magnesium. So just some tips on eating more magnesium in your diet. You want to cook with legumes. So those are your beans and your lentils and your chickpea and your tofu at least 2 to 3 times a week. See how you can incorporate more meatless meals. So make things like dal, add lentils to beans or beans to soups, use chickpeas on salads, make hummus. Lots of great ways to incorporate these legumes, especially in the wintertime. They're so hearty and filling. Snack on nuts and seeds and add them to cereals and salads. For most of my patients, unless they have a nut allergy, I actually give them a prescription that says include a handful or about a quarter cup of nuts and seeds every single day. There's so many benefits to doing that. And then lastly, when you're choosing whole grains, make sure they are whole grains rather than the processed white flour or white bread, white rice. Look for whole grain bread, brown rice, oatmeal, fortified cereals, and pasta. If we talk a little bit about magnesium supplements, these are available in different forms. The supplements that dissolve in water well are better absorbed than the solid forms. And one of the side effects of magnesium is that too much can cause diarrhea, nausea, or cramping, but a little bit can help with your bowels. And magnesium is often found as an ingredient in laxatives. So you might have heard of things like milk of magnesia. Well, that's a magnesium supplement. Now, you want to make sure you don't go too high with magnesium supplements. They can interact with medications. And we also know that if you do have impaired kidney function, you have a greater chance of magnesium toxicity. Now, I often see patients who are using magnesium to help with sleep. And the problem there is oftentimes they go out and take a large dose magnesium supplement. Now, there's no research to back the benefit of high dose magnesium for sleep. And you want to make sure that if you are taking any sort of magnesium supplement, you stay under that upper limit number. And you really want to sort of weigh the pros and cons of taking that magnesium supplement. Again, like calcium, it's always better to take magnesium from your foods rather than go to the supplements. Okay, so I'm going to move on to iron. That's our next mineral. And this is especially of importance to women. When we look at the role of iron, it's a component of hemoglobin, which is a protein in our body that helps transfer oxygen from our lungs to other cells of our body. It's also a component of myoglobin, which provides oxygen to our muscles. And we know iron is necessary for growth and development and normal cell function throughout our life, but especially in infants and children. When we look at iron requirements, the daily goal is between 8 and 27 milligrams per day. You'll notice women need a little more iron than men. And the upper limit or stay below amount is 45 milligrams per day. And for iron, that's a combination both from your diet and from supplements. Now, iron deficiency is something that you can detect through blood work. When you have mild iron deficiency, serum ferritin is lower. When you progress to iron deficiency anemia, iron stores are exhausted and your hematocrit and hemoglobin levels decrease. Symptoms of iron deficiency include fatigue, being tired all the time, tummy upsets, impaired memory and cognitive function, a decreased immune system, and impaired body temperature regulation. Women, again, are at highest risk, as well as preterm infants and children. There's also something called iron deficiency of chronic disease. So people who have cancer, kidney disease, GI issues, or heart failure are also at a greater risk for iron deficiency. Now, when we look at maintaining our iron levels, there are lots of foods that are high in iron. You'll see those legumes and beans again. Red meat, an excellent source of iron, and also fortified cereals. So I think it's a myth that you have to eat lots and lots of meat to make sure you get enough iron. There are plenty of other sources of iron in our diet. And in North America, we know a lot of grains, whole wheat flour, and breakfast cereals are also fortified with iron. When it comes to dietary iron, there are two forms. The first one is called non-heme iron, and this is the one that's found in plants and fortified wheat products. Our body absorbs non-heme iron, but not to as much of an extent as the second form of iron, which is called heme iron. And that's the form you find in meat and seafood and poultry, and our body actually absorbs more iron from these sources. But I'll give you some tips on non-heme iron in a minute. So if we look at good sources of iron, you'll see beef up there on the list, but you'll also notice that, when you look at things like your cereals or lentils, they're just as high, if not higher in iron. So, you want to look at those as well in your diet. You'll see molasses there as a good source of iron, and also spinach. So your dark green leafy vegetables would also be a good source of iron. Now, in terms of enhancing your iron absorption or maximizing the amount of iron that your body is absorbing from foods, you want to make sure that, especially with the non-heme iron, that you take in vitamin C. So we know foods that are rich in vitamin C, like citrus fruits, berries, kiwi, peppers, can also increase iron absorption. When you combine sources of heme and non-heme iron at a meal, so for example, if you're having dal and you have a little bit of meat with that, that will increase the overall iron absorption. There are compounds like phytates that can be found in foods that may reduce iron absorption. However, in a typical mixed diet, so if you're eating a lot of variety, these have very little effect on your iron status. We do know that coffee and tea can reduce iron absorption, so it's always a good idea that if you are drinking coffee or tea, you have it after a meal rather than with your meal to make sure you don't decrease the iron absorption of your food. Now, just some tips on incorporating iron into your diet. Having a little bit of meat a few times a week, but again, having those legumes very often, at least a few times a week, including dark green leafy vegetables on a regular basis, and then looking for fortified whole grain breads and cereals. So again, if you're looking at that nutrition facts panel on the label, you're looking at products that have 15% or more daily value for iron, and that would make it a good source. If you are eating meatless meals, making sure that you do have vitamin C rich foods in those meals, so having a salad filled with vegetables on the side, including things like broccoli or kale or peppers. If you're having cereal, adding berries to your cereal or having kiwi, having fruit with your breakfast will enhance the iron absorption of your breads and cereals. When we look at iron supplements, many types on the market. Sometimes if you are dealing with iron deficiency anemia, there is a role for supplements. Many of the multivitamins that are formulated for women will give you 18 milligrams or 100% of your daily requirement for iron. If you are looking at individual iron supplements, the ferrous forms are more bioavailable or absorbable than the ferric forms. But we do know at higher doses, all iron supplements can cause nausea, they can cause stomach pain and constipation. There are newer forms on the market, such as iron polypeptides and iron polysaccharide complexes that may give you fewer side effects. But in my experience, the side effects from iron supplements are very individual. Different people react differently to different forms. So you have to try a supplement that works for you and gives you the least amount of side effect. Sometimes, again, having a smaller dose or having iron every other day can help reduce the side effects. In terms of absorption, we know also calcium supplements can interfere with iron absorptions. So if you are taking calcium and iron, you might want to take the supplements at different times. If you're taking an iron supplement, you don't want to take it with a meal that maybe has a lot of dairy in it, because that will reduce the absorption from that iron supplement. In terms of too much, definitely you can get too much iron from supplements. This can interfere with the absorption of other minerals in your diet, such as zinc. They can interfere with certain medications. And we know, especially in children, high-dose iron supplements can cause organ failure. So you want to really be careful. Most iron supplements do have a warning label, and you want to keep them out of reach of children, because even taking a few of these can cause organ failure or coma or even death in children. So be careful that you don't keep your iron supplements where your kids can reach them. Okay, there are no questions about iron. I can move on. Actually here, can you shed some light on what fortified cereal means? Do fortified cereals have specific vitamins or minerals? Okay, great question. So in Canada, I know many breakfast cereals have been fortified with iron. So on the label, you'll see a statement that says fortified with iron. And then on that nutrition facts panel, you'll notice that it gives you at least 15% or more daily value for iron. You'll also see grains in Canada. So for example, if you buy a bag of flour, it will say fortified with iron, and iron has been added to that flour because the flour itself is not super high in iron to start off with. So that's what you would be looking for in terms of fortified. Okay, so I'm going to move on to the last mineral I wanted to talk about, and that is zinc. And I'll come back to some of the questions that are popping up at the end. So the reason I've added zinc to my presentation today is because I know, at least here in Toronto, we're in the peak of flu and cold season, and oftentimes people wonder about zinc in terms of preventing colds. So let's take a look at the role of zinc in our body. So we know that zinc is a big part of our immune system. Zinc also helps make proteins and DNA. It's essential for growth during pregnancy, infancy, and childhood. It's crucial for wound healing and maintaining our skin health. It's also involved in proper taste and smell senses. And we know also zinc can slow down macular degeneration or other eye issues. Now, if we look at zinc requirements, they're between 8 and 12 milligrams per day, and you want to stay below 40 milligrams, and the upper limit for zinc is based on both diet and supplements. Zinc deficiency, although rare in North America, it is quite common in other countries, especially third world countries. We know that zinc deficiency can slow down growth in infants and children. It also weakens the immune system, so it causes a greater risk of infections. We know often zinc is used to treat infectious diarrhea in children living in undernourished areas of the world. It can also help reduce symptoms and promote recovery from infections. Zinc deficiency can also cause diarrhea, hair loss, eye and skin sores. It can slow wound healing, and it can lead to a loss of taste. We know in terms of risk, vegetarians are actually at a higher risk because they're excluding a lot of the animal sources of zinc, and they may need more than the recommended amount for zinc, and that can go up to about 50% more than the average person. So the question, does zinc help fight colds? So if we look at the research, there is some research to show that zinc may decrease the duration or shorten the duration of a cold. So we know that if you take a zinc lozenge within 24 hours of first coming down with the symptoms of a cold, it may decrease the duration of your cold by a day or two. However, unfortunately, zinc does not prevent colds or ease the symptoms of colds. And also, when you are taking zinc for colds, you want to really make sure you don't get over the 40 milligrams per day. So really, it's trying to get more zinc from our diet. You'll notice those legumes, beans, and lentils at the top of the list here in terms of foods high in zinc. All your meats and animal foods also contain zinc, and things like pumpkin seeds are also a great source of zinc. So here are just some foods that contain zinc. So you'll notice things like your beef and your chicken on the list there. Pumpkin seeds are an excellent source of zinc. Also things like wheat germ, and again, your lentils and chickpeas, as well as some of your dairy foods can contain zinc. I haven't put oysters on the list because they're not a halal, but those also are one of your best dietary sources of zinc. Now, in terms of incorporating more zinc into your diet, including lean meat, chicken and fish several times a week, including those legumes often. You can buy cereals that have zinc added to them. And then, sprinkling things like nuts and seeds on your foods, especially things like your pumpkin seed. Add them to salads, add them to cereals. When you're cooking, see where you can add in nuts and seeds. Those are all great ways to get zinc into your diet. When it comes to those zinc supplements, they come in various different forms. Some are tablets, you can get sprays, lozenges. There's no clear advantage of one form of zinc over another. Most multivitamins contain a little bit of zinc. When you look at products targeted for colds, they often come as nasal spray or lozenges. You want to really be careful with the sprays because using too much of that can cause loss of smell, and sometimes this can be permanent. So again, be careful with those sprays. We know excess zinc intake can lead to copper deficiency and lower immunity. So getting enough zinc helps your immune system, but getting too much can actually have the opposite effect. We know too much zinc can also lower your HDL, that's your good cholesterol, and it can also cause neurological problems. Zinc can also interfere with medications and also certain antibiotics. So again, really important that if you are fighting the flu or a cold, you speak to your doctor before you start taking any zinc supplements because they can have the opposite effect in terms of your immune system and also interfere with the antibiotics that you might have been prescribed for that flu or cold. Okay, I always like to end with this slide, and that goes back to all the foods that are mentioned in the Holy Quran and in Islamic medical wisdom. These have stood the test of time. I know nutrition research sometimes shifts over time. Sometimes it's not so black and white. It's sometimes very misleading or gray. But we do know that foods that have been mentioned in the Holy Quran and in Hadith have always been good for us. And the ones I have here, like the milk and the figs, the dates, those lentils, those are all high in the minerals we've been talking about. So I think, the bottom line is lots of variety in your diet, but really focusing on the foods that we know have been mentioned in the Quran and in Hadith is really important. So make sure you're including these on a daily basis as well. I'd like to end off with some resources for you. So the first website here, unlockedfood.ca, that's one of my favorites. It's a great website for reliable nutrition information for any stage from infancy to adulthood. It talks about all aspects of nutrition. It gives very practical resources, downloadable tip sheets and recipes as well. So unlockedfood.ca. It was formerly called Eat Right Ontario, so you might be familiar with that one. There's an app called Cookspiration and a website as well, cookspiration.com. That's an excellent resource if you're looking for websites or recipes. These are all recipes tested by dietitians, so all healthy and lots there. You can search by type of meal, or even if you have allergies or intolerances, you can search with those criteria as well. In Ontario, we have a service called Telehealth Ontario. That's a free service where you can speak to a dietitian with any of your nutrition questions. Other provinces in Canada do have similar services, and you can look online for the number there. And then the last website, cardiaccollege.ca, that's one that's near and dear to me because I've been developing that part of that website. And it's a great resource, especially when it comes to label reading and grocery shopping. In fact, this week we've just uploaded 19 short videos that teach you how to choose different products in the grocery store. So for example, how to choose milk and alternative, or how to choose a cooking oil, or how to choose snack foods, or how to choose your best fruits and vegetables. There are some videos and tip cards that you can download on that website. So some great resources. I think just coming back to some of the questions that have come up, I'd like to answer them in the next few minutes. So I'm just looking at them. Does cooking vegetables reduce their vitamin and mineral content? And would you advise eating more raw? Okay, excellent question. So in terms of vitamins, there are certain vitamins like your B vitamins and vitamin C that are destroyed the more you heat them and the more you expose them to liquid. So if you're boiling vegetables, you do destroy some of the vitamins. However, when it comes to minerals, so things like calcium and iron, you actually don't destroy them when you cook them. So in terms of should you eat your vegetables raw or cooked, I think it's actually a combination of the two. So it's just getting enough of those vegetables in. So whether you enjoy them raw in a salad or just raw carrots or peppers, that's a great way to eat them. But if you prefer them cooked, whether you steam them or you grill them or bake them, or stir fry them, that's also a good way to cook. And in fact, sometimes some of the antioxidants in vegetables are released when you cook them. So it really is a combination of the two. Okay, a question about my hands have pain. What vitamin deficiency could cause that? Tough question to answer because there are so many deficiencies that might lead to pain. I don't know if I'm the best person to answer that. That's where you might go back to your doctor, maybe get some blood work done, maybe get a bone density done to see if it is something to do with your bones or if it's more of a nerve or a muscle issue. That's the best I can answer because there's so many different causes of pain and it's hard to pinpoint one deficiency. So how is it possible to identify one lacking in any of the minerals we talked about? So with calcium, it's really bone density. So it is recommended that adults every couple of years do get a bone mineral density scan done. This is something that you can, very non-invasive, something that's quick that you can get done, get a referral through your doctor. Many labs do it, and it's a short test, and they'll let you know how dense your bones are. So the denser, the less holes or the less porous they are, the better your calcium status is. When it comes to magnesium, a little bit harder, but again, if you do think that you have issues with magnesium, you can get a serum magnesium test done. When it comes to iron, that's an easy one. So most times when you have your physical done, or if you're complaining of lack of energy or fatigue, they'll test your hemoglobin and your hematocrit and your ferritin levels, and that will let you know what your iron status is. So a lot of the times it's just a simple test, but overall I would say, you know, if you are meeting your requirements, maybe take a look at your diet and see you know, what foods you're eating and if they are good sources of calcium and magnesium and iron and zinc, and that's the best way to know if you're getting enough. So coming back to that question for constipation, well, number one, I would say is lots of fiber in your diet. So eating lots of fruits and vegetables and whole grains, those legumes, so beans, lentils, chickpeas, a great way to get that fiber in. Adequate magnesium can also help with constipation. And the important thing to note, though, is when you increase the fiber in your diet, you also want to make sure you're getting enough fluid, because fiber does its job by passing through your system. And if you don't have adequate fluid, that's when you can run into problems with more gassiness, or you mentioned burping, or just bloating with fiber. So fiber, number one, and make sure you're getting enough liquids. That's probably the best way to deal with constipation, both in adults and in children. An excellent question. Do frozen vegetables have the same amount of minerals and vitamins? And yes, they do. So frozen fruits and vegetables are an excellent source of vitamins and minerals, especially when you live in climates where we have the winter season and fresh fruit is either less available or more expensive. The frozen produce is a great way to get those vitamins and minerals in. And in fact, sometimes the vitamin content of your frozen vegetables is actually higher than your fresh, because it's flash frozen right at picking. So all the vitamins and minerals are retained in there. Whereas if you're buying fruits and vegetables that are traveling a long distance to get to your grocery store, and then you're keeping them around for a while, they do lose a lot of those vitamins in storage. So frozen vegetables, a great choice. Okay, a question. Is bone density done with a yearly physical, or do you have to ask your doctor or request for it? How often does one need to get it done? So it is not usually done yearly, unless you have an issue with osteoporosis, then it's done more frequently. But usually it is recommended that after the age of 50, or for women after menopause, you do get bone density tests done. Based on your results, it will kind of determine how often you're doing them. So whether you need them every couple of years or less often, more often, would depend on that first initial test. If you do have low bone density and then you do go on calcium or vitamin D supplements, they might redo that test more often just to see what the progress is and if you've slowed down that bone loss. Okay. Cramping in your legs can mean many things. It can mean a lack of magnesium. It can also mean a lack of potassium. So again, with pain, it's hard to pinpoint what the cramping is coming from. You might try increasing potassium or magnesium in your diet, so more fruits and vegetables, more nuts and seeds, and see if that helps with that cramping. A question, what brand of multivitamin is good for senior men? Hard to recommend one. I think, again, as I said, it's crucial that you really try to get most of your nutrients from your foods rather than relying on multivitamins. The only exception would be vitamin D. And in terms of brands for vitamins, I don't think there is one brand that I recommend over others. It's just taking a look at the bottle and seeing if it contains the nutrients that you're concerned with. That's where maybe speaking to a pharmacist might be a good idea. But general rule, the price doesn't really dictate how good that supplement is. I know there are supplements that you can buy online that tell you that they're better than anything you can buy in the pharmacy, and they cost maybe 10 times as much, and in reality, they're exactly the same as what you would buy in your pharmacy. So hard to pick out a brand. It really depends on what you're looking for. So a question there, is there a specific time better when taking vitamin D? Vitamin D is a fat-soluble vitamin, so it is absorbed better when you have a little bit of fat with it. So I always recommend taking vitamin D with a meal. And in my case, I always just take it with breakfast. So I know, if I'm having milk or yogurt that has a little bit of fat or some nuts or seeds in my breakfast, it's going to help me absorb that vitamin D. So take it with your meals rather than between or after your meals. Okay. I don't see any more questions, and I know we're almost out of time. So thank you all again for joining in today. I hope that this has been helpful, and you'll take some of these tips and incorporate them into your diet. And maybe right now, if you've finished listening to this, you might go and have a handful of nuts or go and have a glass of milk or make some chai with lots of milk. Thank you so much for joining in. Assalamu alaikum.